Welcome to the learning module on the precordial stethoscope with the pediatric patient in mind. This old relic, is it time to resurrect this dinosaur? What is the precordial stethoscope? In anesthesia practice, up until about the late 1970s and the early 1980s, the precordial stethoscope was the only useful continuous patient monitor around. Before modern day anesthesia, with all of our technology and all of our monitors, the anesthetist giving anesthesia would use their senses to assess their patient. They would use their sense of observation. They would be observing the patient's skin color, the patient's lips. They would look at the blood, and that all determined the oxygenation of the patient. Was it blue? Was it red? They would use their tactile sense by feeling for the pulse. They would put their finger on the temporal pulse. The temporal pulse would let them know if it was strong, the blood pressure was probably good. It would also let them know the rate and the rhythm because there was no EKG machine to assess that. They would also have to manually take the blood pressure, which means they would switch their stethoscope between listening to breath sounds and doing a manual blood pressure. Out of all of this came the precordial stethoscope. The precordial stethoscope could be placed on the chest and left there, listening to breath sounds, and there would be a stopcock in the tubing that can then switch so that it could hear, they could determine the blood pressure. Then, in the mid-1980s, monitoring standards began to become officially recognized, with much emphasis on the ever-improving electronic monitors. By 1991, capnography and pulse oximetry were firmly established. At this time, the precordial stethoscope failed to hold the interest of anyone new entering the profession. Now this slide just shows the comparison of modern anesthesia tools to observe and assess a patient compared to old-fashioned ways. Now, while the EKG and the pulse oximeter are instantly detecting any kind of changes in circulatory system, acute changes in respiratory function, for example, anything with the upper airway obstruction, a laryngospasm, wheezing, endobronchial intubation, those things all can go undetected for a short but critical period of time when you're just relying on capnography, pulse oximetry, and the intermittent application of a standard stethoscope. Welcome to modern day anesthesia. Does this picture look familiar to you? We have technology that can do everything for us now in the operating room. But as you can tell, everyone is relying on technology in this picture. The surgeon's looking at it, the anesthesia provider's looking at it. There is nobody looking at the patient. Technology is looking at the patient, but the human beings are not relying on their sense and things that they can observe from their patient. The next several slides I'm going to go over is going to show you how a precordial stethoscope can be used also with modern technology that can give you what we call situational awareness. It lets you see what is the patient telling me and what is technology telling me, and by using it together, you'll have the best outcome for your patient. The next 4 slides is just going to be a refresher on the different components of a precordial stethoscope for you. The precordial stethoscope has a precordial chest piece which goes onto the patient's chest. A precordial chest piece is a weighted bell-shaped chest piece that's made of a material that allows for adequate weight to be provided, an airtight seal between the patient's chest and the actual chest piece. The chest piece can come into 4 different sizes. You have the neonatal size, which is really good for your preemies, your micro-preemies, or even your brand new newborns. Your infant size, which is good for, depending if it's a 40-week gestational baby or up until like 1 year of age. And then you have your pediatric chest piece, which is a little bit bigger and a little heavier than your infant one. And then the last one is your adult one, which is used for the adult patient. Anesthesia today has us going into a lot of out-of-department areas. One of those areas is the MRI suite. Now the traditional precordial chest piece cannot be used in there because it is metallic and it will be brought into the magnetic field. But they do have some MRI compatible chest pieces. It only comes in the pediatric size and the adult size. This slide here shows precordial dots. Without a precordial dot, the precordial chest piece would just slip off the patient's chest. All a precordial dot is a double-sided sticky tape. One side sticks to the precordial chest piece, the other side then is placed on the patient's chest, and it keeps the chest piece in its place on the patient's chest. Now the easiest way, as the top picture shows, the easiest way to apply this precordial dot is to first take the top sticky part off and place it on your chest piece. So therefore, when the patient comes in the room, all you have to do is grab that little blue tab and pull the white paper off and apply that to the patient's chest. Now, what exactly is a precordial stethoscope? A precordial stethoscope is actually when you have the chest piece attached to an audio conducting tubing which is connected to a monoauricular earpiece worn by the provider. Now the earpiece can be custom made or it can be a pre-bought one that should fit most people's ears. If it's custom made, it can be made by an audiologist in your area, or you can actually have a custom made earpiece through a mail order kit sent directly to the producers of the earpieces themselves, and that costs about $75. So what you see on this slide, you have 4 different examples. The 2 on the left are custom-made earpieces, and then the 2 on the right are actually disposable ones.